to say, what's it like?
Oh my God,
working in
y'all.
such a sterile environment with docs? Do you
tell you
dig it? Do you not dig it?
They love me there.
I'm
because
sure
it is
they
just
love
lit
you.
from when I
No
walk in the
F-bombs
door.
in the hospital, Cara.
Right. Well, let's talk about that.
Yeah, okay, let's talk
discuss
about
this.
that.
Okay.
So you
what
cannot
happened
be
was-
throwing F-bombs in the
Did
hospital.
not. I don't think so. Okay, so what happened was, when I first got there, the first patient I had was a 34-year-old woman, and the doctor walks in, and he's like, okay, and then laughing with her and having a good time. He's like, well, nothing of hers have ever stuck. She's always had complications, but you're in great hands. And I'm like,
Nothing ever
okay.
stuck. What do you mean, the tattoo
oh my
work?
God, everything she ever did.
Because was it the doctor?
No, it's not tattooing.
Oh, okay.
Her incision, she'd get an infection, or the breast implant wouldn't.
So
not
every
take.
step of the
Every
way
single
went
step.
wrong.
And I'm like, oh, and then she's just gonna come to me, and an expert in hands like me. Okay. So I'm like, so what music do you? This is my first day on the job, Teryn. I'm telling you this story.
In a hospital with
In a
doctors.
hospital,
Well, let
right.
me ask you, what
I'm
are
in
you
my
wearing?
little
You
scrubs.
have to wear white smocks and
I'm
all
in
the
some scrubs.
You're in scrubs. Okay.
Little cute ones.
Okay.
My fit, because does not do well for your figures.
No.
Okay.
Well, some
anyways,
people are
let's get back to the point.
Okay.
So I was like, okay, pumped up. This girl, nothing has ever worked well for her. I'm gonna make her have fun at least.
Okay.
So I say, okay, young lady, what is your music? She's like, I like hip hop. I was like, I love hip hop too. So I put on the hip hop station.
Okay. I have rules about hip hop here at the studio.
I listen to whatever they want. You know, you gotta ease your
Okay.
mind. I'm used to it. Okay, Jared.
Okay.
I have a playlist in my shop. Anyways, point.
Okay.
So here I am, moving to 2. It was only Rihanna, thank God. And so
Well, she's
the
not really
doctor
hip-hop,
walks.
is
She's not
she?
hip hop, but it was just on. I think it was like Eminem and Rihanna had a song together. Eminem is hip hop.
Eminem's hip hop, and he says some dirty words.
A little bit.
Okay, a little bit.
Guess what happened?
Okay, so let's do the
Guess
story.
what happened? I guess I'm sweating right now. So the doctor, he had came in.
While you're doing the
Middle
areola
of tattoo,
tattoo,
and I'm like,
and you got hip hop
I
playing.
had hip hop playing. Eminem had yet to spit his rap, and I'm sure was talking very vulgar
Okay.
in his rap. But yeah, he walked in the middle of the hip hop, and then he walked in, and he looked like he just made a mistake hiring me. And I'm like, I was this close. I'm like, you are wearing gloves in the middle of the titty tat. There's no way you're gonna be able to stop. And I was like, how can I really?
Even the word titty tat with like,
Can I
right?
say that this on?
Yeah, like ruffle
Right.
panties at the hospital, right? You can't say titty tat, can you?
I say it.
You say at the hospital you can
Because
say
they
titty
know
tat.
me now. They know me now.
Because I call them tit twos. Yeah, I like that word, tit two.
I'm going to take that.
Oh, you can take it.
Thank you very much.
Yeah, I came up with that like years ago. I can't claim I came up with it, but I started using it like 15 years
Now
ago.
Will is going to make you TM it.
Yeah,
Trademark it.
maybe.
For
But a
those.
tit two, isn't that
That's
fantastic?
2. I say to 2. Okay, so I walk in. I'm like, oh my God, okay. And I'm like, hi, doc, how you doing? I put down, as rapidly as you can, like, totally play it off. I put down the machine, and I put down the machine, and I'm like, taking off my gloves. Like,
Trying to change the station.
and I think I'm gonna like Christian music. I just went there. I'm like, I don't know. I don't think
Yeah.
Eminem's gonna pop on in on
Yeah.
Jesus loves the little children.
Yeah, because it's different in a medical setting.
So I learned that lesson. Nothing was ever said. And
Yeah.
then I showed him, he walked in and he's like, wow, they look so good. And I'm like, okay, at least I made up for that. And I never did it again. But I walk in, I play music. It's on low.
So now you don't give the clients a choice.
I do. I give them
You
a
do.
choice. I was like,
Christian,
Christian,
country,
country,
or
old,
oldies, 50s.
or oldies.
Okay,
Yeah,
that
classic
works.
rock.
Yeah, classic rock.
No, but I do actually listen. I
No
have a
hip hop.
playlist.
Hip hop's off the. Sometimes I like.
I don't have any clean hip hop. Christian.
like in my
Christian
tattoo
hip-hop.
room, my own personal tattoo room. Like
What are you
Elv-
listening to?
Well, I'm listening to
wanna know.
like Etta James and
Oh, yeah,
Elvis,
soul.
the Eagles.
Right,
You
right.
know, Jackson Brown. I like some stuff. I like the variety.
It's all about the environment.
But I walk out into the lobby where Olivia, working at the front desk, and
Olivia,
Ashley.
what do you play? Wish she needs a
Hip
mic
hop.
so bad. You play
Hip hop. They play hip hop.
You're like, hey, it's Teryn
They play hip hop.
I could do
Yeah.
that too.
So I'm always like, okay, as long as the hip hop don't have no nasty words and calling women, then I'm fine
Right.
with it. Because we get a lot of,
we're classy.
we get a lot of mature women
Absolutely.
that don't appreciate the hip hop. And of
No.
course, we get young girls that love the hip hop. So I think you gotta like music, and we talk about music sometimes in the industry. Like,
Yeah.
what kind of music do you play at your
You gotta
studio?
set your mood. It's
Yeah.
like a first
You can't
date,
play music
Teryn.
that offends a certain type
Anybody.
of woman that comes into your studio.
Right.
And maybe
But-
50% of our clients are 40 and older. We do a lot of 60, 70, 80-year-olds.
Right. Well, even though
And
it's-
hip hop is like noise to them.
Right. Some of them, it definitely is. But it's, like I said, it's like you're dating your client in a way.
Yeah.
And you don't want their first impression to be you know, in a negative way.
All right.
So that's why I have no music playing when they walk in, but I can control that environment in my room. But when they walk into the studio, like
I gotcha.
my assistant, she's playing something.
I worked in a
appropriate.
medical setting for.
How was it in the doc setting?
You know, it was, you know, I was at a salon for 12 and a half years. And then I got so booked out months and months and months and months. I needed to get some artists trained under me and open up a studio. You know, that's how I ended up here with Amber and Michonne and Stephanie and my artists. But while I was searching for the right studio lease, there was some stuff going on at the salon, so I had to move out. So I had a really
Of
good
all places, Teryn just went up into the hospital setting.
Yeah. So I went from 12 and a half years to a salon where it was pretty open. You could do whatever, you know, not so stuffy.
Teryn, darling, you're just a trendsetter of all avenues.
Not really. But my client owned a medical spa, and I love her. So she offered a room, and it was temporary. So I was there about 7 months while I was looking for this place. And loved her, right? Loved the staff, but it was so, I don't know.
Oh, I need a stiff
I almost
drink
felt
when
not
I leave
comfortable
the
showing my
hospital.
tattoos there. Yeah, it was just, you know, like no music. I don't know. So I love a studio setting where you get some music going.
It's just not my environment.
No. But a lot of people in our industry are very spa-like. They like more medical setting, like my good friend Mary Richardson.
Yeah.
Very, you know, more in the medical spa type. Totally suits her, totally her.
Yeah.
You know, her and I are so a lot alike, but very different
when you're
in our
doing
styles
work
and
for
our
a
vibes.
hospital, going back to I'm there, I'm doing literally, they treat me like I am someone that they're coming in to do the plastic surgery. Like they treat me like I'm a surgeon.
Yeah.
They've given me a big head. I think it's amazing.
Yeah.
I am like, oh, they're like, this is our expert. She's amazing. I'm like, keep it up. Keep telling me and call me pretty too. But yeah, seriously. So I'm there in the hospital and it is not stiff. I try not to make it stiff.
Yeah.
Because it's so bland walls and it's fine. So we have fun. But when we're in my shop, it's more fun.
So I would say, you know, wrapping this segment, and then we'll get to our last little segment. I guess my advice, probably our advice to newbies entering the industry, because I see this question a lot. You know, where did you guys all set up? You know, should I be in a hospital or a spa? Should I get my own place? And I think that really depends on your personality.
Amen.
Like
where do you want to spend your time?
Where do you want to spend your time? What kind of environment?
It's like a relationship.
More medical, more
everything.
You know, and not that a studio with music and a little bit more, you know, can't be professional, because I think we run a really professional joint here. But it's
very
kind of
professional.
tattooy and a little edge to
really
it,
is.
music and fun at the same time. So
Yeah.
So some people are going to thrive and do really well and feel comfortable in a medical spa setting, and some people are just not going to feel comfortable in that setting at all.
Yeah, some people think you have to either be in a medical setting or a spa-like setting to get clients, and to
Not
make
true
that
at all.
Totally not true.
Yeah, not true at all.
I was in the street shop.
Yeah.
Is typical like downtown, urban shop, and I had these women rolling up in their like very expensive cars, and they're like, oh my gosh, and they're very well to do, and they're walking into the back, and I try to get them in the back as quick as possible.
All right.
So they don't leave. So it doesn't matter. It's you spend most of your time at work. So why not enjoy the environment you're in?
Yeah.
So whatever you like to do.
Gotcha. One last thing about Ariel is, do you train? So for permanent makeup artists
I
watching
do.
us, they're
I do
going to want to
train.
know if you train. Do you train?
I do train.
So contact you where?
Yes. So you can contact me. All my information, including social media, is at Spot On Beauty Casey.
You know how I feel about areolas? It's the one thing, the one procedure we do as permanent makeup artists. That's a body tattoo.
Yeah.
Where you have to do light and dark shading, get the illusion of depth, and protrude, right? The illusion of protrusion.
Ooh.
You're going to steal that one too, aren't you? Matter-a-tat.
I will say it.
Tatter-a-fact.
Listen, this is our first time.
But that's okay too. I mean,
I'm so sorry about that.
yeah. You know, tattoo,
Tattoo.
Illusion of, but it is the one area we do where we're creating like body art, right? Illusions of 3D and shading, texture.
Yeah, and
texture.
when I teach, I have them come to the hospital. I do about 6 to 8 patients when I'm there, and I do like a small, like I don't do a big group of people.
Yeah.
I do small one-on-one because my name is on you.
Yeah.
Don't mess up and say I learned from Teryn.
Yeah.
No.
Well, you know, maybe 20 years ago when I entered the industry, and for a long time after that, areola tattooing and my own work, to be quite honest with you, was probably a little flat. Now, my areola work evolved into this, and I see some of the greats out there doing great areola work have evolved into more texture. You know, we're doing the glands, we're doing a lot more texture. Sometimes I'm seeing a little bit too much texture.
Yeah, it's like a cartoon.
It's like a cartoon.
It's
too
like
much texture.
It's fine.
And that's not going to age well. But
you can cover. That's the cool thing about areola tattoos.
You can cover it back up.
When I first started, I was like watching these other artists, and I was like, "That's amazing." And I'd get carried away. I'm like, oh, "Shit!" It was like 9,000 little mammary glands all over.
Yeah.
Like, but the next time they came in, it was healed. I just went over it and covered it. I colored. You can cover dark with light.
Exactly.
Or light with dark.
Exactly.